Mr. Bloom?
I do.
You sure about that?
Yes, I am.
Oh, okay.
That's 2403. Shall I head right into that, Mr. Chair?
Please do.
All right. And thank you again, Mr. Chair and committee members. I'm now presenting Assembly Bill 2403, which would require the Department of Health Care Services to give notice to cities and counties within their jurisdiction regarding the application process for adult recovery or treatment programs for alcoholism and drug abuse. I'd like to begin by accepting the committee's amendments that are being distributed right now in mock-up form that will protect existing facilities and address concerns on housing access. I'd like to thank the Chair and the committee for working with my office very diligently to strengthen and clarify the bill. The purpose of this bill is to prevent overconcentration of multi-structure facilities in residential neighborhoods with the aim of maintaining the purpose and integrity of neighborhood care programs. Alcohol and drug abuse treatment facilities have become prolific in California. These facilities, with capacities of 6 or fewer persons, often occupy single-family residential homes, as intended under the law. However, due to the profit margins within economies of scale, these facilities often expand into neighboring residences. This can, and in many cases does, create multi-structure campus-style facilities, even though they're zoned for a single-family residence. While these facilities play a key role in the communities and the individuals, their expanded scope, capacity, and overconcentration can undermine the goal of using residential neighborhoods as a therapeutic environment for the social integration of high-functioning disabled persons, including recovering alcoholics and addicts. This bill provides consistency with all other state-licensed group homes, such as allowing for a 300-foot distancing requirement and noticing of licensing applications to affected cities and counties. This bill ensures that group homes can exist in neighborhoods without overcrowding and protect the therapeutic and nurturing environment that benefits the residents in these facilities. With me are Christy Hogan, the City Attorney for the City of Malibu, and Lou Lamont from the California Contract Cities Association.
Great, thanks. So you have 3 minutes each, okay?
Oh. Thank you, and good afternoon, Chair and members of the committee, I guess subcommittee. I appreciate the opportunity to address you on this issue tonight, and thank you, Assemblymember Bloom, for authoring this bill. The legislature has declared that state policy is to encourage both a sufficient number and types of facilities to treat alcoholism and drug addiction. AB 2403 does two important things to preserve the availability of different types of facilities within the existing licensing structure. Under current California law, non-medical alcohol and drug addiction recovery programs are licensed either as a residential facility or as an integral facility. First, AB 2403 clarifies that the license must match the type of facility. A residential facility provides non-medical services to 6 or fewer adults recovering from addiction in a residential neighborhood. And that's the social model that is promoted in California law. This inclusion, this sort of mainstreaming into the neighborhood is part of the recovery process to reconnect a person in recovery with the community, clean and sober. Residential facilities are treated just like any other family under zoning laws. The other type of facility is an integral facility, which serves more patients and can include multiple structure. These facilities offer more of a retreat environment, more of an insular setting, and they're a good alternative to single-family residential model. AB 2403 reinforces the goal of making both types available. The second is AB 2403 applies the same 300-foot distancing requirement that's currently applicable to many of the group homes under the Community Care Act. 300 feet is roughly one facility for the average city block. So that's not an onerous requirement, but its purpose is to provide a single-family neighborhood, which is a beneficial component into these licensed facilities. With the bill, Licensed residential facilities can function as a family among families in California's residential neighborhoods. AB 2403 reinforces the state goal to provide a variety of types of facilities. And we understand that there has been skepticism about legislation in this general area, and I'm happy to answer any questions that you have. But with the chair's amendments, this bill is not new territory and does not wade into any regulations that go beyond the state's current basic licensing. AB 2403 is designed to make existing law work. To sum up, AB 2403's purpose is to give patients in licensed alcohol and drug rehab programs what California now promises, and that is a variety of types of programs to choose among, including the option of a residential program in a residential neighborhood. And again, I appreciate the opportunity to ask respectfully for your support today.
Thank you very much.
Thank you, Mr. Chair and members of the committee. My name is Lou Lamont. I'm here today representing the 76 contract cities, who, along with the 475 cities of the League of California Cities, are sponsoring this bill, and they're part of a strong statewide support system for AB 2403. AB 2403 will help maintain residential neighborhoods as a therapeutic environment for recovering patients. A drug and alcohol rehab facility in a 6-bed, single-family home is welcome in any neighborhood. It's good for the community, it's good for the neighborhood, and most importantly, it's good for the patients who are trying to recover. But when one facility gets so profitable that it buys the house next door, and the house next door to that, and the one next door to that, and pretty soon they combine services to take advantage of economies of scale, the rehab facility changes a residential neighborhood into a hospital zone. This has happened with all the ones you see on television tonight and many, many more. These operations overwhelm the community infrastructure and harm the character of a neighborhood of single-family homes. These multi-structure campus-style facilities are licensed as if they are separate home units, like a family of 6, but they're not. These facilities are subverting the intention of neighborhood care, and that is detrimental to the patients who benefit from the support of an actual neighborhood. Other group homes licensed by the state have noticing and distancing requirements to avoid overconcentration. AB 2403 creates consistency with other Community Care Act facilities and protects access to true neighborhood care facilities. This legislation is a simple correction of a loophole that has been exploited and turned into a massive and very lucrative business model that is spread all over the state. And if it isn't in your town yet, it will be soon enough. This bill is the right thing to do for all the communities that all of us represent and for the patients who are trying hard to recover within all of the California communities. Thank you.
Thank you very much. Witnesses in support? Additional?
Mr. Chair and members, Kendra Harris, representing the 475 cities with the League of Cities, we're pleased to sponsor this important measure, and we ask for your aye vote.
Thank you.
Jorge Morales, Mayor of the City of Southgate, on the Executive Board of California Contract Cities, in strong support.
Thank you.
David Jones, on behalf of the City of Sacramento, in strong support.
Great, thanks.
Alex Gibbs, on behalf of the City of Mission Viejo, in support.
Thank you.
Good afternoon, Mr. Chair and members of the committee. Paul Gonzalez, representing the cities of Lakewood, Thousand Oaks, Redding, Norwalk, and Southgate, all in support.
Great, thank you. Opposition. Anyone speaking in opposition? Please come forward.
Mr. Chair, Mike Carroll with the Western Center on Law and Poverty. Unfortunately, we do have some concerns with this legislation. For many years, it's been the policy of the state of California to try to encourage local communities to build the capacity for special needs housing opportunities for people who have a variety of needs in our communities. As such, the legislature many years ago chose to effectively eliminate the ability of local governments to be able to use their local zoning and conditional use permits to limit the number of units that would be available for these kind of services in our communities. Unfortunately, many of the folks who end up needing these services are often viewed in sort of a stereotypical form. There tends to be significant community opposition to the siting of these facilities. And historically, it's been very difficult for local governments to resist that local pressure that they feel that comes from people in their community who oppose the siting of special needs housing kind of projects in their community. As such, we've had a long-standing policy in our state to try to encourage the development of these facilities as 6 and under uses. What this bill does, unfortunately for us, is that it takes some of those units that are currently viewed as 6 and under, and I know the amendment's apparently grandfathering, we haven't seen the language, but would apparently grandfather in existing uses. But going forward, those facilities which under current law would not be subject to a local planning process or to a conditional use permit by a local government would now be subject to those kind of conditions. In fact, the language of the bill that at least is in print now actually uses the word conditions when describing whether or not the department could approve a license that was less than 300 feet to override the overconcentration provision that's in the bill. So in our view, the ultimate effect of AB 2403 will be to limit the availability of special needs housing opportunities for people with drug and alcohol, and potentially this goes to other kind of facilities that we want to make sure are in full supply or in strong supply in our state. And for those reasons, we have to oppose the bill today in committee.
Thank you.
Mr. Chair, members of the committee, Robert Harris on behalf of the California Society of Addiction Medicine, California's 400 medical specialists who deal in addiction. We don't believe there's a proliferation or an overconcentration of treatment facilities. In fact, it's just the opposite in California. Now with the ACA and parity being enforced under the ACA by CMS, and with California's new 1115 waiver that's finally creating a treatment system for people on Medi-Cal, we have the opportunity to vastly expand the number of people in treatment to stop the people who are still addicts on the streets causing crimes. This is exactly going the opposite direction. Now you're going to limit how many facilities you can have, where you have them, and try and push them out in not my neighborhood but some other neighborhood. What I find interesting about who's up here testifying in support of the bill is it's cities. Who isn't here is the counties who have the responsibility for delivering the services to people. The only county organization who's involved is the behavioral health directors who are opposed to this bill. Why? Because their job is to get the services to people. You know, I understand the concept of not in my backyard, but if we do that to everybody, all we have is drug addicts in our backyards, and we don't have people in treatment. And having people in treatment's the critical issue here. So because of that, we have to oppose the bill. Maybe the amendments that we haven't seen take care of some of the problems, but until we see those amendments and understand it, we're opposed to the bill.
Great. Thank you very much. Others in opposition? Just your name and organization, please.
My name is Dave Sheridan, the Executive Director of the Sober Living Network and the President of the National Alliance for Recovery Residences. We strongly oppose the pieces of the bill that violate people's civil rights.
Thank you.
Pete Nielsen, California Consortium of Addiction Programs and Professionals, and we oppose this bill.
Thank you.
Sherry McHugh, representing One Method Treatment Center and Cliffside Malibu, in opposition to the bill.
Thank you.
Steve Carlson for Promises Treatment Centers in opposition.
Great. Thank you. Anyone else? Anybody in between? Seeing no one else, we'll bring it back to the committee for questions or comments. Mr. Thurman?
Thank you, Mr. Chair. I wanted to ask a question to the author. I have to say, at the last bill you presented, I was all ready to vote for your bill and excited. You had me inspired that we could help individuals. I have questions about this bill and who it seeks to help in terms of helping individuals. And perhaps you or your sponsors can elaborate specifically what it is that you are trying to achieve or the problem you're trying to fix. I get that generally we don't want there to be bad actors, if you will, who say that they are there to provide treatment, and that could have a negative impact on the people served as well as on communities. But it does seem to me that it would not be unusual for there to be contiguous housing locations that provide treatment. And so out of respect, I'm trying to learn if there's something specifically within your district that you are trying to fix as a problem.
Yeah, I think you heard from Mr. Lamont that there are numerous circumstances where instead of, as is the case with all kinds of, with every other similar type of facility, 6-bed facilities have a distance between one another. What's happening in this particular area is that they're locating next door to one another, building a fence around all of them and creating a compound-like environment. This is the thing that is antithetical to what we all, I think of as a residential neighborhood. It's the issue we try to get at, but what we're really trying to do here is create parity amongst all of the similarly situated types of facilities. Nobody, and I say nobody, is talking about not in my backyard. Everyone on this bill is accepting of the fact that there are needs for these services and they are appropriately located under California law, current California law, as a 6-bed facility, single facility in a residential neighborhood. The entire purpose of having that type of facility is to allow folks who need the kind of recovery services that they can get at these facilities to recover in a neighborhood-like environment. But it's self-defeating when we create a compound. It's self-defeating for those facilities, although it's more profitable, but it is also a net negative when there is an overconcentration for the residential neighborhood. So the bill is really a simple effort to try and create some balance, and that balance has already been struck with all of the other types of facilities, and perhaps Ms. Hogan would like to add some comments.
If I may, just you ask a very good question, which is who does this help? What is it aimed at? And the positive that it's aimed at is to protect the particular model of the social residential facility. The residential facility requires two things, both the facility itself for what goes on inside the house, but also the neighborhood in which it's situated. The whole idea of the model is to re-enter into the community now clean and sober and learn what it is like to, offer to take out your neighbor's trash or to interact with the regular rhythms of a residential neighborhood. And so that with the residential neighborhood itself provides part of what is being offered in these facilities. But it's become a very lucrative business. And so what's happening is, in some cases, as Councilmember Lamont points out, more contiguous lots are being bought up, and now you have an integral facility in what was once a residential neighborhood. There is totally a place for integral facilities in California and in this bill and in our licensing scheme. But we want to make sure that we also take the precautions that are necessary to preserve the residential model so that it has basically a residential neighborhood to come home to. And let me also just point out really quickly that this bill does not give any authority to local government at all. It doesn't give any conditional use permits or variances. It doesn't cross that line at all. It just provides notice. Whether or not there's 300 feet is a factual question. So that's going to be done by math, not by fear or stereotypes or prejudices.
Thank you to the author and sponsor, and I appreciate, and I'm sympathetic, and to the council member, I'm sympathetic to your concerns. I wasn't concerned about giving more authority to local government. I think where I am is I am going to try and find balance between. I agree with the opening statement you made, Assemblymember Bloom. You said that no one community should have all of these services in them. I think that every community should have them, but I don't think that any community should ever be oversaturated. I represent communities that sometimes get oversaturated with services. Having said that, I think what we have to do here today is balance how do we prevent oversaturation from, how do we prevent blocking communities that need more than 6 beds to provide treatment and to be able to still work in the community. And so I appreciate your clarifications on your intent. Thank you.
I want to be clear, if I might just add one more comment. When we speak about community, we're talking about 6 beds being roughly a block from one another. So within a neighborhood, you could have any number of 6-bed facilities. It's having them within 300 feet or being contiguous to one another that's really the problem.
Thank you.
Great, thank you. Other questions or concerns, comments? Okay, seeing one. First of all, thank you, Mr. Bloom, especially for working with me on a Sunday afternoon. Quality time together. Appreciate that. I want to thank you for you also for taking on this really challenging issue. And my concerns are similar to those that I stated on Ms. Melendez's bill earlier on. It's an issue that impacts all of our communities, urban and suburban, wealthy and poor. No one is immune to the devastating toll drug and alcohol abuse takes on our neighborhoods. It appears that the issue around here is around concentration of facilities, and it feels like it's the byproduct of some opportunistic folks, and that's unfortunate in the impacts it's having. However, it is essential that we strike a careful balance between preserving the needs of our neighborhoods and protecting the rights of the people who are seeking care. It may be a simple bill, but I still have significant concerns around the legal issues that, as I mentioned before, that this could be set up to discriminate against people who are protected under the Americans with Disabilities Act and the fair housing rules. I want to thank you for accepting the amendments. They are extensive, and I appreciate that. I believe that by permitting instead of requiring, DHCS to deny licensing applications based on proximity to already existing treatment facilities, and this bill is headed in a better direction. My recommendation is going to be aye when we actually have a quorum, which we're getting closer, by the way, inching there. But I would
I can
say,
wait.
Pardon?
I said I can wait. I can be patient.
I would say that obviously with an issue that continues to go back into the 80s, should these bills that I'm recommending go out today not be successful, I would look forward to working with you and the other author on potentially a hearing, something to actually sit down, put everybody at the table, and see if we can collectively come up with a solution that works for everyone. I think year after year, bill after bill, clearly hasn't been effective. We have a stack about this thick of previous legislation analysis and on this particular issue. And while I'm recommending an aye, I'm not sure that stack isn't going to grow a little bit more at the end of the day. So I appreciate your efforts and appreciate the concern and appreciate you tackling a difficult topic, Mr. Bloom. So when we have a quorum, we'll call for a vote. Okay.
Thank you very much.
Thank you very much, Mr. Jones.